Assalamu alaikum. Today we are going to discuss about the ENT's Ospe, and here are some instruments which I will show you in this video. I must say that these are super confusing or super challenging instruments for you as a student, but I will tell you that how you can differentiate between these forceps. These forceps more or less look like scissors, so these are confusing very much for us as a student. But let's see that how we can differentiate in between these instruments. In front of you here is shown tracheal dilator, and the tracheal dilator, how you can say that this is a tracheal dilator? Just look at its two or three things. One is that it has a screw joint here, screw can be seen, and number two is that it has somewhat blunt edges are shown here, and these edges are also somewhat curved. Remember that it is only slightly curved, not much curved. And number three, that I was used to think or I was used to cram it as a tracheal dilator, was that between its two prongs here is somewhat extension present between, or somewhat connection is present between its two prongs. Okay, you can also remember it as this, as I was used to remember. Here you can again see that uh, here this is another tracheal dilator, this is another tracheal dilator, another tracheal dilator. I hope so that this will be clear. Number two, this is another tracheal dilator. Here zoomed out picture has shown that it has somewhat blunt edges and these are slightly curved, and it has a screw joint. Next one, on number two, I will tell you their functions later on. We can also cover its functions together with it. Its function is mainly, as its name indicates, that it is tracheal dilator, so it is mainly used in the procedure of the tracheostomy, and it is used to keep the tracheal edges open. As you know that what is tracheostomy like. Suppose this is a trachea, and we have created an opening in the trachea, and this is known as tracheostomy. But we have to keep the tracheal edges apart from each other, so we have to use this tracheal dilator. On number two, this is mainly your tonsil holding forceps. Students actually confuse between the tonsil holding forceps and lux forceps, but just carefully see it that in tonsil holding forceps, first of all, its name, as its name indicates, that it is mainly used for holding the tonsils. Okay, there is no other function of it, like it is not used for cutting the tonsils. It is only used for holding the forceps. Sorry, tonsils during tonsillectomy, as its name indicates, that it is a tonsil holding forceps. Number one feature is that it has somewhat box type of joint. It doesn't have a screw like I have shown you previously in the brachial dilator that had a screw. Here you can see there is no screw. It has a box type of joint. And number two is that its upper jaw is somewhat smaller and its lower jaw is somewhat larger. And when we close this instrument, then its upper jaw is smaller than its lower jaw, so its upper jaw will fix into its lower jaw just like a box. So its two jaws also have a box like mechanism in its jaws and in its joint as well. You can remember this from a mnemonic, as tonsil holding forceps starts from T, so you can remember it from TB. That T stands for tonsil holding forceps and B stands for box mechanism. Okay, let me show you another instrument of tonsil holding forceps. Here you can see that it has its upper jaw is somewhat smaller as compared to its lower jaw, and its joint is also somewhat has box type mechanism. Here you can see another, if you zoom it out, you can see that its upper jaw is slightly smaller than its lower jaw, and it also has box type of joint. So this is tonsil holding forceps. I have also told you its function, that it is used for holding the tonsil and pull it medially in the dissection of the tonsil. Here you can see on number third instrument is lux forceps. Here you can see that in the case of the lux forceps has both upper and lower jaws approximating with each other. It means that their size is equal to each other, and when we close this instrument, like its upper jaw is this and its lower jaw is this, when we close this instrument, these two jaws will approximate with each other rather than fixing or into each other or boxing into each other. Okay, and number two is that it has screw joint. Here screw is not shown, but you will see a screw. Maybe its screw is on the other side, but in this picture it is not shown. You can remember that it has screw type of joint from the mnemonic, that in lux there is S, so you can remember from it that it has screw type of joint. Here you can see another type of lux forceps. Here you can see that here somewhat screw is shown. Okay, it is not much clear. And here you can see that its two edges are approximating with each other, or they are equal in size with each other. Okay, here Here is another lux forceps. Here screw can also be seen, and its upper and lower jaws can also be seen that they are equal in size with each other. Okay, now let's move towards the other instrument. um, this is mainly another confusing instrument, I must say. Here are two other confusing instruments that students confuse in between these two. This is Tilley's nasal dressing forceps, and the other one is Hartmann's nasal dressing forceps. In Tilley's nasal dressing forceps, here you can see that it has somewhat angled shanks. Okay, in Hartmann's nasal dressing forceps there are also angled shanks, but here in the case of Tilley's dressing forceps, its tip is somewhat serrated. Okay, here you can see it's zoomed out picture of Tilley's forceps. Okay, here is another picture of Tilley's dressing forceps, but in the case of Hartmann's dressing forceps, let me show you. In the case of Hartmann's dressing forceps, here, this is the Hartmann's dressing forceps. It has also somewhat angled shanks, but remember that it has a screw joint. Hartmann's nasal dressing forceps has a screw joint, and its edges are very much serrated. Okay, very much serrated. You can easily see here, just like a toothbrush. It is shown here. Okay, and in the case of Tilley's dressing forceps has somewhat box type mechanism. How you can remember it? As in the case of tonsil holding forceps, you remembered it from pneumonic TB, and in the similar case, you can also remember it from Tilley's nasal dressing forceps as TB. This is T for Tilley's nasal dressing forceps and B for box mechanism. But in the case of Hartmann's forceps, there is uh, a screw present. Okay, what is the function of Tilley's nasal dressing forceps? This is mainly used to perform anterior nasal packing. Number two is that it is used to remove foreign bodies, crusts, or packs from nose. Number three is that it is used to pack the nose with gauze strips during nasal surgeries or sinus surgeries. And number four is that it is used to remove cartilage and bone pieces during septoplasty. Okay, functions are more or less similar of Tilley's nasal dressing forceps and Hartmann's nasal dressing forceps. I hope so. This will be clear. Now let's move towards another instrument. Here you can see that this is the tonsil artery forceps. It is very much like a scissor. Okay, like a small scissor. Here you can see, but these are two extensions that approximate with each other when we close this instrument. And number two is that this is just like a scissor and straight. This is straight tonsil artery forceps, and if it has somewhat curved edges here, then this is curved artery forceps. Okay, here you can also see this is another type of instrument. This is mainly Negus artery forceps. It has somewhat hooked like edges. Okay, proper hook or very sharp edges, I must say that it has. Okay, here you can see that it has hooked edges, and these two as well. Okay, so that was all. These instruments that I want to cover here were all of these. One instrument has been remained, that is peritonsillar abscess forceps, or we can also call it as. This is another type of tonsil artery forceps. This is straight artery forceps, and this is curved artery forceps. This is slightly curved, not much curved like Negus artery forceps. Okay, remember it as well. And one instrument is remaining, that is peritonsillar abscess forceps. I must say that it has somewhat diamond like shape. When we close it, this instrument, it has somewhat diamond like or triangle like shape. Diamond like or we can say half diamond shaped or somewhat triangle shaped. Okay, edges it has like this. Okay, so this peritonsillar abscess is has mainly guarded edges or diamond-like or triangle-shaped edges. It is also known as quinsy forceps. Here, this instrument is mainly, or this forceps is mainly used to search out the pus through the crypts of the tonsil, and it is also used for evacuating the pus. In this case, intraoral incision is given either under general anesthesia or no anesthesia, and we make the child to sit in upright position because in the case of the drainage of abscess, there is a risk of aspiration, so we do not do this procedure by letting the child to lie down in a supine position. We have to make the child sit in an upright position in this case. Okay, now let's move towards Shruti Dhingra. Here you can see what is this. Here is shown lux forceps. Okay, its upper and lower jaws are equal to each other, and they are approximating with each other. And here is a screw joint, as I have told you to remember it from screw word, S word. Okay, Here you can see that this is Tilley's dressing forceps as it has somewhat angled shanks. Hartmann's dressing forceps also has somewhat angled shanks, but you have to see its tips. Okay, these are very much serrated, as somewhat prominence can also be seen in its tip. Okay, and its jaw is grooved as well, like groove is also present in its jaw. Okay, and then we can also see from here that this is the tonsil holding forceps. Okay, this is the tonsil holding forceps. um it has box type of joint. Okay, and it has box type of mechanism as well, like its upper jaw fixes into its lower jaw. Okay, and then comes the tonsil artery forceps. Here is the straight, here is somewhat curved, but this is the Negus artery forceps. And these all of these artery forceps are mainly used to seize the bleeding point or to catch the bleeding point, or while ligation of the artery we have to use these instruments during tonsillectomy mainly. And then comes the peritonsillar abscess forceps, which has somewhat triangular shaped or prominent saw tip. Okay, um, I hope so this will be clear to you people. Let's do another quick revision. This is tracheal dilator, tracheal dilator, tracheal dilator, tracheal dilator, tracheal dilator. This is tonsil holding forceps. Here is the ligation of the artery shown. Here you can see that this is the Hartmann's forceps, and here is the peritonsillar artery forceps. Here is another peritonsillar artery, peritonsillar abscess forceps. Okay, or Quincy forceps, peritonsillar abscess forceps, and this is the Tilley's dressing forceps. Again, Tilley's dressing forceps. Here you can see another Tilley's dressing forceps. This is mainly your tonsil holding forceps, and this is your lux forceps. This is tonsillar artery forceps. This is curved tonsillar artery forceps. This is your Hartmann's forceps. This is your tonsillar artery forceps, and again this is lux forceps. This is lux forceps, and this is Negus artery forceps. Again Negus artery forceps. Again Negus artery forceps. This is Hartmann's nasal dressing forceps. This is lux forceps. This is your tonsil holding forceps. This is again your tonsil holding forceps. Thank you very much.